Adult female acne. Hello everyone, and thank you for tuning in. In this episode, we're joined by Dr. Diane Berson to discuss some additional clinical pearls on the treatment of adult female acne. Dr. Berson, what are some typical acne presentations seen in adult women?
Adult women can actually have mild acne or severe acne, just like anyone else. Very typically, though, women who have even had acne that was severe as a teenager find that they do continue to get breakouts, often premenstrually on the lower part of the face. So I would say that we classically talk about the adult woman flaring on the lower part of the face around the time of her menstrual cycle, most often on the chin, most often presenting with cystic lesions on the chin. And this can still be frustrating, although it could be just mild, but it could occur every month.
Can acne in women persist beyond menopause?
Acne can definitely persist beyond menopause. As a matter of fact, after menopause, women lose their estrogen, which almost helps protect against acne breakouts, but their adrenal glands are still making androgens. So very often we'll find that women who are postmenopausal almost become oily again, as they were when they were an adolescent. And certainly it's not uncommon to see acne breakouts. And again, they're losing that protective estrogen. So you can have acne whether you're an adolescent, a young adult, a middle-aged adult, or a postmenopausal woman. It really can affect you at any age.
Can some of the newer non-oral contraceptives exacerbate acne flares? What are the options in this case?
Well, since we know that acne can flare with hormonal changes, even when you're put on an oral contraceptive pill, which is beneficial for acne, the acne can get worse before it gets better because it's a hormonal change. Some of pills are actually worse for acne, although the majority of birth control pills do decrease acne breakouts. With respect to IUDs, we are now seeing a popularity of IUDs that contain progesterone. And as we know, when we take the birth control pill, it's really the estrogen moiety or the estrogen component that's helping the acne and counteracting the effect of the progesterone, which is not always helpful for acne. So very often I see women present to me who have not only recently gone off the birth control pill, which can make their acne flare, but they also got a new IUD, often a progesterone-releasing IUD, which can wreak a little havoc on them hormonally and cause their acne to reemerge. In those instances, if they're happy with the IUD, I might just add in some oral spironolactone, which is an anti-androgen that might help counteract that negative effect.
Is there a concern with hyperkalemia in patients taking spironolactone for acne?
Most of the young women who we treat for acne are usually healthy young women. And in a healthy woman, we don't have concerns about hyperkalemia, especially with the doses we're using for acne. Sometimes patients are well controlled on a dose as low as 25 milligrams. And that's equivalent to the dosage that's in one of the popular birth control pills that we actually use for acne. It's equivalent to the 4 milligrams of drospirenone that's in Yaz. And so if we're getting 25 milligrams, I'm not concerned. And some patients do take 50 or even 100 milligrams. But if it's a healthy woman with no underlying kidney disease, usually it's not a concern. If you're getting into the higher dose range, as we sometimes do for those with hair loss or hirsutism, then you just want to make sure that the patient is healthy and doesn't have any underlying medical conditions. But I do not routinely follow it in my healthy young women.
What should dermatologists keep in mind while treating acne in adult women?
Well, I think there's three things I would discuss. First, when it comes to treatments, such as the prescription treatments we use, it's the same as it is for anyone else with acne. We usually use a combination treatment usually a combination of a topical retinoid and a topical antimicrobial, and sometimes an oral antibiotic for severe cystic acne, and certainly isotretinoin for those with more recalcitrant cystic acne. But the treatments are the same. But the second thing I do take into account more frequently is the role of skincare and which vehicle I'm going to pick. So when I'm giving prescription treatments, I'm going to pay attention to the formulation or vehicle of that particular topical and make sure it's the appropriate one for the woman's skin type. And I also make sure I take into consideration various aspects of skincare. For instance, women are going to be often using makeup in the morning. So if they have a topical to use in the morning, I want to make sure that it applies easily and cosmetically acceptable with makeup application. I also discuss what moisturizer they should use, what cleanser they should use, and very often an adult female is often dealing with anti-aging concerns. So I'm often mixing her skincare routine and her acne prescriptions so that I can address both her acne and her anti-aging concerns at the same time. And finally, the female patient, as opposed to the male patient, can be treated with oral hormonal therapies, whether the birth control pill or the anti-androgen spironolactone. And so this is something we have to offer to women, for instance, who get cyclical flares of their acne. So basically, prescription treatments, as for everyone else, skincare, which is usually going to be tailored for that individual woman, and then the advantage of being able to use hormonal therapies when they have a hormonal influence to their acne.